Oh, I haven't got a microphone. Not that important, but.
Hello, good afternoon and welcome to the Health and Wellbeing Board. I am Councillor Lucy Steels-Walshaw, Executive Member for Health, Wellbeing and Adult Social Care. As this is my first meeting, it'd be really useful for me if we did some introductions. I know that you've generally all met before, but it'd be really useful. So if I just go around to my right, if that's okay.
I'm Tracy Wallace. I'm the Health and Wellbeing Partnerships Coordinator.
Good afternoon. I'm Sarah Coltman-Lovell and I'm the NHS Place Director for the York Health and Care Partnership.
Lucy, I think you know who I am, but I'm Councillor Webb. I'm Exec Member for Children, Young People and Education.
Sarah Story, Corporate Director for Adult Social Care and Integration.
Alison Summers, Chief Exec of York CBS.
Sian Balsam, Manager of Healthwatch York.
Good afternoon, I'm Brian Cranach. I'm the Care Group Director of Operations and Transformation for Tees and Weir Valleys across North Yorkshire and York.
Ashley Mason, City Councillor, and only my second meeting as well, so still learning.
Martin Kelly, Corporate Director for Children's Services and Education.
I'm Ben Georgic, I'm the Director of Public Health.
I'm Councillor Carol Runton, and I'm Shadow Executive Member for Adult Social Care and Public Health.
I have a microphone, but I'm Ben Jewett, Democratic Services Officer, taking the minutes.
Thank you very much, everyone. I should say we've got one lot of apologies from Zoe Campbell from Tuve, and is it Brian is here in place of Zoe. Okay. Does anybody at this point have any declarations of interest they'd like to make? Nope. Okay, and the next item, agenda 2, is the minutes of the meeting held the 8th of May this year. So obviously I wasn't at this meeting, but are there people here who can confirm that they are an accurate record? Yeah. Okay, thank you. Okay, so if we move on then to public participation, we have one person registered to speak in public participation, and that is Ben French, who is going to speak on item 8 about the delivery of mental health services and the importance for lowering the thresholds for access and co-production, and item 9, the importance of health goal A23, the vitality assessment of investment in green spaces and local parks. Ben, if you'd like to come forwards, you will have 3 minutes. Would you like me to give you a 30-second warning?
Yes, please. Thank you.
Thank you.
Thank you, Chair and Committee. Ben French from York Green Party. So as I mentioned, I just wanted to speak very briefly on a couple of items. First of all, item 8, particularly with reference to Annex B, the excellent Healthwatch York report and some of its recommendations. And also on item 9, on the importance of Goal 9, Action A23, increasing access for children and young people to green spaces and investment in them. So first of all, with reference on Annex B, on some of the Healthwatch York recommendations, particularly page 43, there are a couple of excellent recommendations. First of all, B2, so decreasing the thresholds for mental health access to reduce the strain on crisis services. And also the Healthwatch recommendation, restructuring co-production to make sure this influences delivery. So having worked with a number of vulnerable people and having the experience of friends, I know that these are really important areas. First of all, when accessing mental health support, the threshold can be so high, even for those with severe mental health challenges. One person that I worked with received a rejection letter denying them access to mental health services based on a small support network, including family members, none of whom had serious mental health training. For another friend, in addition, working within the system, I know that it can be very difficult to be listened to and treated with dignity and compassion. My friend fought a running battle with the system to avoid being discharged. and this was severely difficult. People should not have to fight tooth and nail to get the support that they deserve. The system should be there for those that need it. I hope that the committee can reflect on some of this. And secondly, with reference to goal 9 and A23 in item 9 on the joint health and wellbeing strategy, increasing access to parks and green spaces. So in a tight budget environment, surely access to green spaces, parks and community spaces should be so important and should be prioritised in upcoming budget decisions for so many obvious reasons, for health and well-being and much more, and all of the finances that they actually save in the long run. For example, I was at a recent meeting in Hull Road in Tanghall, where I live, of residents discussing the future of Hull Road Park, a beloved community space. Many residents and families talked about how they didn't feel like they could take their children to the park, as it was scruffy, lacking investment that the residents crucially needed.
30 seconds left.
This was vital, and it was a real tragedy. They felt they had to take their children elsewhere. The council should be noting of this and how important it is to local residents to have a green space, to take their children, to look at nature, and so important for mental health. I would encourage the council to prioritise investment in green spaces, and in addition, helping residents to access the finances they need, as this is something many are so passionate about. Thank you for your time, Chair.
Thank you very much. And your comments will be noted when we get to the relevant items. Thank you. Oh. Okay, so we move on to agenda item 4 now, which is the presentation from the Poverty Truth Commission. If you'd like to come forwards, please. Okay, thank you. So I envisioned you'd like some time first to do this presentation, and then we'll have some time afterwards for questions, comments from the people around the table. Do you all know how to work your microphones? Just press the button and the green light will come on. The button that says mic underneath it. Yeah, okay, thank you.
Gary's just sprung that one on me. So Gary and some of our marvellous community commissioners are coming to talk about their findings from the Poverty Truth Commission. And I think you have to have one mic on at a time, is that right? Does it matter if both lights are on?
Yeah, you can have 3 on at a time.
Okay, right, off you go.
Thank you. Thanks, everybody. Thank you for inviting all of us. I'm sure you've all heard of the Poverty Truth Commission, and you've been keeping up to date with what's been going on. I'd like to just spend just a minute myself, because it's these wonderful, wise people that I'd like you to hear from. But I am going to feed some questions into them, because as I'm sure you appreciate, it's not an easy thing for people to sit here having to face you all, particularly when it's not been part of your life experience. So, so please be gentle with all of us, actually. As I'm sure you'll always gentle with yourselves as well. So when the community commissioners, that's people with lived experience, got together, there was lots of discussion about the things that really mattered to them, which was the point. And in the end, they narrowed it down to 8 areas that they would really like to see change. And they knew that civic commissioners would be coming along. So they got it down to these 8. And these 8 included, I'm not going to say go for all of them, but they included things like the barriers to engaging in social or public life when you're facing poverty, the new tenant syndrome, white goods, getting a new place, how scary that can be, how lack of support that can mean. The need, this was a very interesting one, the need for prevention and joined up services to stop things getting to a certain point. All fantastic discussions we had with lots of tears, lots of laughter. And of course, things to do with money, and they discussed cost of heating, particularly as things were shooting up at the time, and cost of food, the cost of living crisis, all of these things were discussed. And there were 8 of them that they narrowed it down to. And then I threw a curveball in and said, okay, please rank them and give us the top 3. And I'm sure most of you will have heard by now that the top 3 were understanding, linked with kindness and respect. That was number 1. Communication based on the above, i.e. can our communication from various organisations actually be kind? Can they give us some dignity? Can they treat us with respect? And digital exclusion/inclusion, that was important. So those were the top 3. And the civic commissioners came on board, lots of discussion again, and only one of the outcomes, but a major outcome was, you can see the slide up there, and it's this booklet, and I will leave them around, okay, this is a charter that would actually promote what the wonderful commissioners are asking for, okay, and it actually gives checklists almost for organisations, objectives for organisations, standards, that if they actually followed these, then people would understand, people would be treated a lot more kindly and with a lot more respect. So my first question, that's set the scene for you all. My first question, wonderful people, is out of all of those things, why did you choose something like almost twee, as somebody said? Kindness, respect, dignity. Why did you choose that? Go to Kate first.
Okay, so many of us had came from different backgrounds, and all of us had suffered a lot of trauma, and some of us were living in hostels, homeless, we'd had medical conditions that had ended us. Can you hear you?
You need the microphone to be right in front of you.
Sorry.
You move it along and just put it right in front of you. Thank
I hate my
you.
voice, sorry. So we'd all come from different backgrounds, but when we all got together, the theme was that we'd all been treated with some discrimination, and if we could change one thing, being kind, if the people could be kind, then everything else would be then met. So that was like every single one of us had been treated unkindly. And what we were trying to say to some people is like, sometimes it can be I know it only sounds like being kind, but it can be the matter of life or death. When you've lost everything, you've got nothing, and somebody can either be nasty to you or somebody can be kind. It can make you want to continue. So it was actually very important to us.
Yeah, thank you. Nobody else got anything you want to say?
Well, I'm reminded, I was in a hostel for the homeless about 9 months. As far as I know, I'm still the only person in the country that's been in a hostel for the homeless while being treated for cancer, stage 4 cancer at the same time. And I came across quite a lot of puzzlement and discrimination. But it was little things that didn't really make any difference to anybody that meant a lot to me. My hair was long and thick. It was about 8 years ago now. And I just asked for, when I arrived, I just said, can I have an extra towel for my hair? Because I wanted a shower. And the little towels they give you was, you know, little hanky. And one fella said, no, I'm sorry, it's the regulations. You're only allowed a big towel and a small towel. And then as soon as he'd gone, the other fella went to the back and brought me another big towel. And it meant the world to me because I could dry my hair, you know, and it's just a little thing. It didn't cost anybody. And I was discriminated against quite harshly at a time where I was having high-dose radiotherapy, high-dose chemotherapy, high-dose brachytherapy. So I wasn't exactly in the best of health. And because of my address, I was discriminated against for that. But I'm still here, so
yes.
I could go until 4 o'clock tomorrow morning if you want, but
John, anything you want to say about why you chose dignity and respect?
As you all well know, I think a lot of you know me. Well, my story is a little bit different to everyone else's. I was a professional man, ended up being very ill, and I went to a DWP assessment through adult healthcare. I was treated appallingly. I was a professional man. I'd worked with doctors and nurses in the operating theatre in Bradford. And I reported the doctor because he humiliated me at the assessment, or medical, you want to call it. And that's basically from that, because I reported him, the DWP came down on me like a ton of bricks. I wanted to be treated like a human being. So eventually I went to the High Court with the government, and I'm standing in the dock, and next to me was a gentleman from the DWP. I'm suited and booted, and he had a duffel coat on, hadn't shaved for a few days, sweatshirt on, and the judge thought he was me. So I said to her, I said, that's where you go wrong. You're judging people on what they're wearing. And I said, I've come to court respectful. He's turned up in his duffel coat and sweatshirt and hadn't shaved. And I said, this is what we're up against all the time. So from that moment, I had to put my anger into positive. So that's a long time ago now. And I've since had other operations and that. But if it wasn't for that meeting that doctor in the Atos Healthcare, having that assessment, maybe I wouldn't be standing around this table today. It's from one action. And I always said if I could help one person out, then my job was done. But I've helped out thousands upon thousands of people out in the city, not just here, the charity in Halifax, but it was all down to being treated like a human being with dignity and respect and a little bit of fairness.
Thanks, John. Thanks, John. Okay. An interesting point in the commission, and we had we had equal number of civic commissioners from different organisations, which I'm sure you're aware of. And all of this started to come together with how people with lived experience wanted to be treated. And at one point on one meeting, we stopped the meeting and the question was asked of the organisational leads, have you already got policies that talk about this? And they all said, yes, absolutely. And so we turned to the community commissioners and said, and is that actually happening? And the resounding answer was no. And the subsequent discussions that came out of all of that was this, which we want organisations to sign up to, because if they follow it, this is all what is being asked for. However, next question, is it actually making a difference? What difference has it made either to you personally or what you've seen maybe with the civic commissioner or what you've noticed in an organisation? Is it making a difference? Anybody?
Well, it made a difference for me with the housing. A lady actually from the York Council who helped me immensely, and several people have, and going over and above, because when we first invited the civic commissioners, we thought, well, you know, we didn't know what to expect at all for the first few meetings. And it turns out that they were nice, ordinary human beings, and some of them were extremely nice, and you know, we developed quite a good bond with a lot of them, which was a huge surprise because I don't think any of us were expecting that at all. And a small thing, because it's early days, but the tone of a letter that the council sent out, I got a bill for £670 last November for care that I'd not received. I'm still waiting for care, I'm not getting any. And it was just a little thing, please, you know, I'm an old age pensioner, not in the best of health, vulnerable one on our own. Or for anybody, just check that they actually do owe you so many hundreds of pounds before you send them out a bill. Because the other side, all I could see was bailiffs, and somebody that's not as feisty as me might go into a panic about that, you know. So that was changed, and the tone of the letters that are turned out has been changed. So that was something concrete. So that's a small step, but I'm sure we're going to do an awful lot.
Thank you. Thank you. Yeah. Differences, either personal or something you've seen?
The police are doing a kindness award each month. She's like giving an award to the police, which was quite surprising, but that then gives them an incentive to be kind. And we also done some training with some GPs and nurses, and some of them were totally shocked that some of our, like, sometimes it's really difficult if you've never experienced poverty. You could be telling somebody, well, just go and buy that cream, just go and do this. But if you physically haven't got the money to go to that shop or to buy that cream, and it was quite hard of us to be able to tell our personal stories where we've been let down. But then it was like a light bulb come on some of them, and they were like, oh, right. So it's like some of it has been like, we've actually been able to teach other people what it's like. So, yeah.
Personal question for you, John. Okay. Personal question for you. Has it made a difference to you?
what being on York Poverty Truth Commission, yes, for me, it has personally, it's sort of been the last piece of my jigsaw, for being asked to join York Poverty Truth. So I'm absolutely really honoured and absolutely privileged that Gary, Ali, Peter and Alison wanted me to be truthful. It is the icing on the cake for me, being in York Poverty Truth, and I have seen change, and we have a long way to go, but hopefully in time we will get that change, not just because of my name putting it out, but with the other commissioners that we are trying to make change in the city.
Thanks, John. Final question on these lines. Kate, has it been worth doing?
But I think I'm going to get emotional on this one, but this time last year, I didn't want to live anymore. And now I feel like really proud that I'm like, I feel like York saved my life and York has given us so much. And by being part of this, I can help others not feel the discrimination that I've felt and help others. So, but in turn, like personally, it's just made us feel like worthwhile, like a decent human being. Sorry.
Thank you. Final question, and then we'll open it up for questions. I know I'm being bossy, but brief answers on this one, because I know you have so many amazing ideas. What next? What would you like to see next?
I would like to see more companies, businesses, charities across York and maybe further afield in a few years' time, take up this charter. That would be the ultimate goal. The money, what was spent over the 2 years, would be very well spent if we can roll it out. So that if we do go to the council and they say bad feelings or whatever, you can say, I'm holding you account now. You've signed up to this. It's not just the council, it's the police, it's the NHS and so on. All we're asking for is a little bit of fairness and not to be judged. And that's everyone around the table, by the way, as well. It's just not us. It's everybody.
Yeah, Vicky, is there anything you'd like to see next?
It's a bit personal, but it's my chance to say this. I have been waiting. Don't worry, I'm not going to burst into. I've been waiting since January for some sort of social worker, adult care social worker. I have pelvic radiation disease and all the things that come with that 8 months after my treatment. I've had emergency blood transfusions, general anesthesia, surgery, everything in the hospital in the last 12 months. My bladder and my bowels will never be the same. I have insufficiency bone fractures in the pelvic area, which brings on a lot of pain when I walk. And things I can't do now, I could do a year ago without thinking about it. Simple things like getting in and out of the bath. I've pleaded to your council to get me a care worker, a social worker. And Yorkshire Housing on my behalf have also asked them. 6 months down the line, I've still not heard a peep. And I'm wondering what other sort of illnesses I need to get, because time literally is running out fast for me. And I mean that with all sincerity. And I haven't got that long. So I would like something done about that.
Thanks, Vicky. Citywide, Kate, anything that you'd like to see next?
If these could be like, if people did follow this on, like crisis team, the doctors, the council, and we're only asking for people to like listen, understand, treat us with respect and dignity, and to be honest. And it feels like we should be like the people who are already doing the jobs. If you go for a job and you're a support worker, surely you want to support people. And maybe this, so we've tried to think, why are they like, we've got to sit in their steps, and maybe they're overworked and understaffed and stuff like that. So then it must be better management to try and help or something. We don't know what the answers are, but if we work together with this, it's got to give better outcomes and prevent other people from feeling how we felt.
Thank you. Do you want to just press the green button for a minute? So open for any questions. I don't know how long we've got left because the timing, you whizzed through the first few things. So the timing I've got written down is probably different to what we're allowed.
Thank you very, very much for that. And thank you very much for particularly for people who shared their personal experience. I know that's really, really tough, and thank you so much for that. Regarding how much time you've got left, we can have we've got around 10 or so minutes for discussion within that. So thank you. So would anybody like to start the discussion? Peter, do you want to start?
Thanks, Chair, and thank you all so much for coming today for your input. And I had the real privilege of being at the GP and nurse training as well, and that was fantastic too. And there were some real light bulb moments in there for some of our clinical colleagues, so that was really good to have you. It got me thinking about the word kindness that you used, and almost what are some of the opposites of kindness, and why some of the things you may have experienced in professionals haven't been along that sort of that kindness sort of approach. And thinking about words like curt or unapproachable, formal, or maybe even punitive. It sounds like some of the things you've had sound as if you've not quite fitted the bill of a structure or fitted into the right box almost, and therefore systems haven't been able to deal with it. And you absolutely, Kate, were right to say that there's going to be some explanations perhaps behind that. Exceptionally overworked staff, exceptionally sort of busy wards or GP surgeries, but it doesn't excuse it, does it? And I think there is something, therefore, for all of us to take away about the culture. And you were absolutely right to say, actually, at the end, that management is really key there. We collectively around this table cannot solve the fact that we have too many people coming into general practice and not enough GPs or in all our other services, but we can set the culture. So I guess my comment on the question is that's what I'm taking away from your contributions today, is my role, and I think all of our roles in setting that culture. And the booklet is really helpful, and I've used it within my team, and I'm going to try and keep on returning to it in terms of the type of culture that we want to set. So yeah, again, just thank you very much for highlighting all those issues. Very, really helpful.
Thank you, Peter. Councillor Mason.
Thank you. Thank you, and obviously the same in terms of sharing your story. Obviously, it's hard sometimes to talk about those experiences, so I think thank you for doing it in such a public way. I suppose as part of putting all this stuff together, have you seen any other kind of standout local authorities or other areas that have kind of adopted a similar type of charter, and how that's happened? I don't know if you did any of that kind of research when you were looking at putting this together. And was anything you could suggest in terms of the council adopting this, and what we could learn from kind of how successful other places might have been in trying it?
In terms of something like the charter, we were the first, because York's often the first, isn't it? Which is good. However, you're not allowed to laugh, Vicky. However, it's very interesting that chatting with other people across the country, other poverty truth commissions, this is coming up again and again and again. And so lots of people have been taking this away so that they can study it. There was something with Church Action Poverty that was held at Priory Street, their national conference, and somebody had produced a booklet very similar to this right down on the south coast. But the main comment that came out from that was, yes, it seems to be countrywide. What a shame that it actually even needs highlighting. But it's common, but York seems to be leading the way and actually putting something together like this.
I suppose a question for you, Chair, is just what's the plan with this going forward, I suppose, in terms of the council picking it up?
So in terms of the council picking up, well, a lot of organisations have already signed up to it. And I think tonight we're going to be actually looking at asking people to go back to their organisations and considering the principles behind it, which are obviously absolutely amazing, considering the principles, looking at it and deciding within their organisations if they want to sign up to it. But as I say, quite a lot have already signed up to this. Councillor Runciman, did you have a supplementary on what Councillor Mason was saying? Okay, fresh. Was yours a supplementary? No. Okay. Councillor Webb.
Thank you, Chair. Thanks, folks. I'm a councillor. I'm responsible for children, young people and education, but I'm also a sort of a ward councillor over in the sort of Tangall part of the city, Bell Farm. That's my patch. You won't be surprised, you're not alone in talking about the tone of letters from the council. Vicky, I think you mentioned that in particular, and the timeliness of it. And one thing I has come up certainly in my ward is sort of the language that's used and whether people find that accessible or not as well. And I just wanted to say thank you for raising that. I'm glad that we're starting to see changes already. What were the problems that you found in those letters, in that communication with the council directly?
Oh, sorry. Yeah. When I got the bill, it was just £667. It didn't say what it was for or what department it was from. There was no signature, there was absolutely nothing. And funnily enough, the timing was perfect because I got the bill 2 days before we had a civic and community commissioner meeting. And I was able to show this to one of the ladies that works here, Pamela. Is it Pamela? Pauline. And she took it back and told me she'll get it sorted, and I believe she has. But it was just a mystery, you know, just opened it. You owe this for what for? They haven't even put, because it was a computer, you know.
Yeah, I thought that
Computer.
that might be the case.
Yeah.
I've had one which was someone was sent through, which was quite a different situation, probably a nicer situation. That they were told, oh, the council owes you money, which let's face it is rare.
Yeah.
But again, it didn't say why. It didn't, and I think that just that clarity, we can take anything away.
Yeah.
What we put out to people, we'd save ourselves so much time from people like yourselves going back to the council saying, what's this about? Why am I being asked this? You know,
I mean, again, like I said, coincidentally, 2 days later, we were at the meeting. I was able to bring it in and show it to Pauline. But if I'd been out, you know, 6 miles and you know, mobility issues, having to get a bus to wait to the car, because it's difficult to talk to somebody on the phone about it, especially when you don't know what it's for. And then somebody had said, oh, it's for adult social care. I've not had a minute's adult social care in my life. I'm still waiting for it, so.
Yeah. Well, you know, the average age of that for literacy levels, the average age of literacy levels for people in poverty is actually 13. Yet the letters that get sent out, like as if you've got a GCSE. So sometimes you're in that much stress, you owe everybody, everything's on top of you. You don't know what you're doing. You're just so stressed under so much trauma, and the words are just sometimes just too, where it could be like easier. And one of the things that we brought up was that we are here for the council to like check in with us and say, is this easy to understand? It's asking a question before you send it out. Just get people who can't read that good to read it. So it's like little.
Yeah, Kate, I think that's so important. And I think that could be something, because you're right. Whenever we're in a position where we're stressed out, we're trying to read things quickly. Often what you pick out is the number with the pound sign, isn't it? You know, that's the thing you're interested in, and it's really worrying. So yeah, thank you both.
Can I say a few words? I've got obviously, you know what I do in the city. I had a homeless friend who managed to get a flat, and he got a letter from the council saying he was going to be evicted with his PTSD, mental health. He thought, that's it. So he ended up back out on the streets because the letter said he was going to be evicted with bailiffs. If it wasn't for Pauline, who works in the council, actually going backwards and forwards, emails from me, I shouldn't have to do all this, but this is what I do. That poor lad would have been on the streets. He's managed to go back into his flat, but that was a letter from the council being forceful, saying the bailiffs that are coming, we're going to kick you out. We're going to repossess the property. And it turned out he'd done nothing wrong. So we've got a long way to go. But the shocking thing was that he decided it was safer on the streets of York than in his flat.
Thank you. We're running a bit close to time. I've got 3 more people to speak and then I will wrap up. So Sian, please.
Right, I'm just going to move my mic around because I feel like I can't talk at you and look that way. It feels wrong. But I just wanted to say so much of what you said rang absolutely true in terms of the feedback we get. And it's not just about people in poverty, but actually we've heard from people from the LGBTQ community, people who are disabled, people who are who have dementia, talking about if services and shops and people generally treat each other with respect, with kindness, with understanding, then treating people well never made anyone's life worse. So I think there's something really powerful about the fact that we can make everybody's life better by actually trying to come to every situation with a bit of kindness and compassion. I think what was interesting as well for me was when they first changed the rules about over-the-counter medicines on prescription in 2018, we as Healthwatch, both locally and nationally, raised concerns about how will this be managed for people who genuinely can't afford these medications, because surely what you're doing is putting the emphasis on those individuals to say, I can't afford this. And we all know about stigma and we all know how hard it is to say, I just don't have that money. So I thought, we have raised this before. I think it's absolutely true. I don't know what the solution is in terms of making sure people are aware that they can provide it on prescription if someone can't afford it without making someone declare that they can't afford it. But I have to say, from you, it sounded much more powerful than it did from what we said about it. So thank you. I think sharing your personal experiences is profoundly powerful. And I really hope that everybody signs up to this charter and everyone agrees that what we need to do is just be better to each other. That's, I think, not asking too much. I also thought we've also heard about the issue of tone in letters. I have to say, not just from the local authority, but from all people. And we, again, use a readability panel to help sense check information going out, because we know how vitally important it is that it makes sense. It tells you what you need to hear, and it doesn't set off alarm bells when it doesn't need to. I mean, we heard similar things about council tax benefit letters when people first get into a bit of financial difficulty, but we also heard it in terms of confirming that you were still eligible for a discount on things, and why you had to reconfirm it, and the way that it's put is unnecessarily abrasive. So I think everything you said absolutely rang true. Thank you so much for coming here, and I hope we can all support you. Thank you.
Thank you.
Thank you, Sian. Councillor Runciman.
Thank you, Chair. I'll start off by thanking all 4 of you for coming, but John just illustrated exactly what I wanted to talk about. I was very interested that you boiled everything down to 8 and then down to 3, and I think that must be very, very difficult. And the thing that I have a bit of a bee in my bonnet about, especially at the moment, is digital exclusion. John said he sent emails and he sent emails and he sent emails to sort out a problem. And you were doing that on behalf of that young man. And if you hadn't had that facility with emails, then it might have been much more difficult and much more prolonged, and you might not have been successful. And there is a problem going on at the moment, which some of us will be very aware of, where I've had people saying, I can't do it. I can't do what I need to do on the emails or on the council's website or whatever. And it's not that they're not intelligent. It's not that they're not aware of what needs doing. They just can't. They're perhaps of a generation which wasn't brought up with using emails and using IT. And unless they sort of fall over somebody like John, who can actually spend the time, make the effort and help them, sometimes they are very digitally excluded. And I want to conclude by saying, I hope that if the work that's been done goes back to the organisations will report about what might have changed. And that's one thing I want to see changed, so that we know that everybody's included. So thank you.
Yeah, absolutely.
We have some of the community commissioners who are sitting on the digital partnership thing that's going on, and there's already been a consultation and a chat about this isn't right, that doesn't work, oh, that works. So they're already on it in some respects.
Thank you. And Martin.
Thank you, Chair. Excuse me. So I'm the Corporate Director of Children's Services and Education. Just want to like others, thank you for the work. I think it's fantastic work. I think that the greatness in this is in the simplicity. You're not asking for huge amounts of money and funding. You know, it's not embedded in 40-page strategic documents. It really is simple, and actually it's just about changing the values of people, which you know, sounds easy. It's fairly challenging. I think if you look at children and families alone, we've got around about 17,000 different individuals that work alongside children and families in the city. There's some obvious people within my teams in terms of social workers and at the very hard end of some of the work that we do. I think certainly I've shared the document. We'll continue to work with the document across children's social care and across children and families and the work that we do. We have already got a what we call a practice model that is all about values, that's right across the workforce, and it's just asked some really simple questions about, is it good enough for my child and is it good enough for my family? And if it isn't, stop. It doesn't matter whether it's policy, legislation, something in law, you know, let's just stop and have a conversation and think about how we can do things differently, and come and knock on my door if that takes some senior management to change. Really keen. I know we're having conversations with yourselves in CBS around a Children's Poverty and Truth Commission, and you know, that would be fantastic to try and launch something very similar for young people. Because if we get things right for children in the city, things come right for adults later in life, and it really is the best prevention model you can come across. So you know, I think the work is fantastic. I think the council responds in many ways, not just to this, but actually looking at having a trauma-informed city, which went through full council not too long ago. And we're starting to work on that now. We've got a consultant psychologist starting with us in the next couple of months, and he'll start to lead some of that work alongside the council and with partners. So I think it has set a real shift in thinking, and some fantastic work that's happening as a result.
Thank you. And I just want to wrap up by saying thank you so much for coming, and thank you so much for presenting this. I think the work you've done, and I know within this, you asked organisations if they already had something, and they kind of were like, yeah, but no one's really doing that. And it's so much about culture, isn't it? And this reminds people that just someone being kind, just someone understanding. I mean, Vicky, you said about an extra towel, like that is such a small thing, isn't it, within this, just to make someone actually feel like they matter, like things can change and things are going to be all right. So I would really, really encourage all organisations, if they're not already signed up to this, to definitely get in touch and sign up to this. Gary, I was just going to ask, you had a leaflet before about them. Ah, you've got some. Thank you very much. It was brilliant. Thank you so much. But yeah, thank you very much. The work is so valuable and really, really appreciated. And thank you for coming. Thank you. Thank you. Okay, so if we move on now to agenda item number 5, and that is the Better Care Fund submission and update. Thank you.
Thank you, Chair. So I'll just introduce this item while Zoe and Steve get into position. I don't know if you just want to swap your name badge, Steve. Yep. Thank you. So thanks to the board today for receiving this report, which Zoe's going to take us through in a moment, around the Better Care Fund planning submission. And we've included the submission itself as an appendix to the document, which it's probably fair to say is not the most readable or reader-friendly or user-friendly document, but we have included the full thing, the full item, for full transparency. And I think as part of the report, Zoe has really helpfully sought to summarise in narrative form some of the strategic intent, the vision and the approaches that we hope to take forward when we think about how we use those funds, how we work together, hopefully, to engage with partners and citizens, and how we might work differently in the future, but also to give just a little flavour of what some of those budgets are used for and the performance, the national performance matrices related to some of those. So I'll just hand over to Zoe and Steve. Thank you.
Thanks, Sarah. Thank you, Chair. Members will be familiar with BCF updates coming to the board quite regularly. This one is a little bit different because, as Sarah has alluded to, we have just submitted our annual planning template to NHS England, which is a national requirement that sets out our funding allocations, all of our schemes that fall under the BCF. For those of you who've had the opportunity and pleasure of perusing that template, you'll see that we go into quite a lot of detail around the metrics that we're asked to report on, and how we are using the schemes and crucially the funding to adhere to those metrics and meet those performance objectives. So largely we're talking about admission avoidance, discharge improvement, falls prevention, and discharge to usual places of residence. But essentially it's wrapped up in keeping people well, enabling to stay at home longer and live independent lives, and providing that right care at the right time, but in the right place. I don't intend to take you through the report in detail, but I will pick out some pertinent sections to draw your attention to. Nor do I intend to take you through in detail the planning template. What we've tried to do with our BCF is we have tried to look at it in totality. So we've looked at not only what the core objectives and principles are of the BCF, but what our population needs. So our population is shifting, it's growing, it's changing, as well as those shifts in the political environment, the commissioning landscape. So we're seeing a lot of movement. We need to make sure that what we're funding and our allocations are aligning with that to meet those needs of the population. And I think what's probably really important to address is the fact that up until approximately 6 months ago, we had a BCF performance delivery group. Now, the function of that group is to allow providers and partners to come together to review things what I've alluded to, the allocation of spend, how we fund schemes. Now, when that group was first incepted, although that predates me, all providers were given the opportunity to sit on that group. Now, as ever, over time, what happens is that membership shifts, it changes. Providers will, what we ended up with was a core group of providers that sat on that group. Over time, we saw some providers not attending as regularly as others. So what we were left with was quite a disproportionate representation of the BCF in its totality. Combined with that, we were embarking upon a period of change. There was a change in leadership structure. So our old DAS was stepping down. Our new DAS, Sarah, was waiting to be appointed. So there was going to be a period of flux and interim leadership arrangements, combined with the need for an internal review of the BCF itself. We needed to look at not only how we were spending that funding, but largely we needed to look at how we were contract managing and monitoring the providers and the schemes. We were awaiting some regional guidance on KPIs as well. So we took the decision to stand that group down with the intent to stand it back up in a more timely fashion than we actually have. The review was a lot more resource intensive than we had first anticipated. But it did give officers the chance to do almost a forensic manual line by line review of that BCF in terms of how are we managing the providers, how are we making sure that we are getting value for money. Now, ordinarily, all of that would have been taken to a performance delivery group, absolutely. We haven't had that for the last sort of 6 months. Our future intent is to set that group back up, but to make sure that it's functioning how we want it to function. So we are seeking some guidance from the regional BCF team around the outcomes and delivery and best practice around how those groups should function, taking into account what our own strategic direction is as we shift into a more joint commissioning arena. We want to make sure that we've got proportionate representation on that group and that we are taking those decisions with openness and transparency, and that we are having all providers around that table instead of just a sort of core group of select providers that were the ones that ended up on that group. So I think that's a really pertinent point to bring the board to. You know, we have had some challenge around the openness and transparency of the process, and absolutely, I think that's valid. Normally, our planning submissions would have gone through that delivery group, and it's certainly something that, as we move forward, we will look to be making sure that we do have that function in place. I'll pause there for a moment just to see if there's any specific questions around what I've talked through so far. As I'm aware, there might be one or two around that.
Thank you. Does anyone have any questions on what they've heard so far? Councillor Runciman?
Thank you, Chair. I don't know if this is for you or for Steve, but I want to know how rising inflation has affected your ability to support the services. I did read it. I read all of it very carefully. That's because I'm used to reading it. And it seemed a very good spread of services, but I was concerned that rising inflation might be reducing the support that can be given to some organisations in particular. Thanks.
That's certainly true. One of the points I was going to make is the amount of better care funding that the council contributes to that pool has stayed static for the last 2 years. So in the earlier years of the Better Care Fund, there's almost like a bidding process because there was spare money for where we could do something different. So that's where the local area coordinators sprung from. That's where York Integrated Care Team sprung from. But the ability to do that has changed dramatically because the council hasn't put any extra money in because it wasn't given any extra money. We were dependent on health's inflationary increases to fund our inflationary increases, and there really hasn't been a lot left in terms of providers or, you know, doing something a bit more innovative. So that's why this sort of look that we're doing more recently is about looking whether we're making the best use of our resources as they stand, seeing if there's any sort of duplication in areas of schemes. So it has been difficult.
Thank you. Did anyone else indicate they would wish to speak? No? Okay. Did you want to carry on then?
Thank you. I think what I'd like to do is take the group through some of the schemes that are contributing to some of those performance objectives that I've talked through. So when we think about admission avoidance, it's one of our top priorities. What we often find is we have to reach people before they get to that crisis point. So before there's either a conveyance or an admission. We've got an integrated care team that in-reach into the hospital. What we've found is that we've had very good success rates with that team being able to in-reach into not only ED, but to other areas of the hospital as well. They've been able to pull patients out that aren't appropriate for emergency interventions, get them home within 2 hours and get them the longer term care and support they need. This not only supports admission avoidance, but it also contributes towards things like ED overcrowding, hospital flow. So it's a domino effect. So we're focusing a lot on that kind of integrated in-reach model to really try and avoid those admissions. And when we talk about discharge improvement, we've got a lot of schemes that contribute towards discharge improvement, and there's also a lot of work that goes on outside of the BCF to contribute towards discharge improvement. We've got early support discharge services that help again to pull people out, to get them out of that hospital bed quicker, earlier, to get them home, to assess their needs in their own home environment. And actually, that means that we're freeing up a bed for somebody who does require an acute stay. There's a lot of other schemes that are contributing towards that. And when we talk about discharge improvement, it's not only about discharging people, but it's about discharging people to the right place. That's not always a bedded capacity. That can be a package of care. That can be something other than discharging them to a bed. And that's something that Steve's alluded to. What we're trying to do now is to look at the BCF and look at the schemes. How does that align with what our population health data is telling us? How does that align with what, you know, our data tells us? What do our patients need? Do they actually need bedded care, or do they need more support to enable them to get home, to get back to their usual places of residence? And that's what the data does tell us. We know that acute care is not necessarily the best place for people, and equally we know that a lot of deconditioning takes place if people go straight from acute care to a care home or a bedded facility, whereas if we can get them home with that support and a package of care. And it all goes back, I mean, I'm probably preaching to the converted, and it's not news to anybody, but more investment in community services is what we need to do to actually start to see some of these performance objectives met. It won't surprise anyone to know that the highest volume of spend in the BCF is on community-based services, closely followed by domiciliary and home care. And that's what the focus of the BCF needs to be. Bit of a whistle-stop tour, I appreciate, and there's a lot more detail that goes behind all of this. But hopefully that's given you a bit of a flavour for the direction of travel and where we're trying to move with the BCF.
Thank you very much. Can I just clarify one thing within that? So we were talking about discharge to the right place, but it can be used, correct me if I'm wrong, the other end to prevent
absolutely
initial going into hospital,
yeah,
or some sort
anticipatory care, prevention. It's either end, you know, so it's discharging to the right place, but ideally it's catching the people before they even hit that front door. So that's where the anticipatory care or integrated care teams really come into play.
Thank you very much. Councillor Webb, do you want to come in?
Yeah, thank you. Leads nicely into my question. Firstly, Zoe, Steve, thank you for this item. Having had a look at the planning template, it does explain a lot about why no one understands how the NHS works. Like, it's just huge and vast, and yeah, there's a lot going on there, so I don't envy it at all. If I'm quite simplistic about this, what I'd like to sort of get a bit more detail about is what sort of research is done. What's the process basically between you going, or someone in your position going, there is a need, right? And us working our way through that massive document to get to, there is now a provider who is supporting with that need, and then there is hopefully a positive outcome. And I suppose linked to that, how often are we going through that process? Because, you know, needs change. And finally, what are the challenges that you get back from the providers themselves at the other end that say, well, actually, you're asking us to do X, Y, and Z, but we can't because, you know, what's that whole process really in 30 seconds?
No, I think it's a really good question. I think regarding how we kind of get to that position, when we look at last year's BCF submission, for example, and potentially previous years before that, there's often little variation year on year, and that's often similar with contracts and service specifications. Often it is a sort of historic rollover, but what we've started to do now, and that's part of the review, is actually scrutinise those schemes and look at, okay, are they actually providing what we need them to provide? Are they delivering best value? Are the providers meeting the KPIs? And have we got the mechanisms in place to actually contract, monitor and manage the providers and the schemes if they're not performing? We annually submit that template. But then we do have touch points throughout the year where we review our schemes. But that actual submission where we forecast our spend and our allocation, that's on an annual basis. But as I say, there are other touch points throughout the year where we can look at that. The delivery performance group is quite crucial to that, which is why the fact that it's been stepped down for the last 6 months probably hasn't contributed in a lot of ways. And once we get that step back up, we are anticipating that we'll be able to do a lot more of that and looking at, okay, so what do we need? We do rely on a lot of population health data. We rely on, what does the national data tell us? What do the national indicators tell us? We do benchmark against other systems as well. Previous to this role, I worked in another local authority some time ago and was involved in their BCF. So we do benchmark against other systems to look at how are they providing their services. Regarding your question around challenge from providers, it is a challenge. We have to take into account what's reasonable from providers. So what are they asking for? What do they need? And what are they basing that on? And if there's a genuine need there and they're coming to us to say we can't provide X, Y, and Z because of, it could be something like an inflationary uplift, a financial driver, or it could be something else. It could be that the population need has shifted. And we have to take that into account on a case-by-case basis. And again, the performance delivery group will help drive that forward because we'll have that representation there.
Thank you. Alison.
And I think just to add to what Bob's just asked, I've been on the delivery board for 6 years, and every year there's been a review of all the schemes. But I have to say, I think this review is probably it's going to be different. I think it's going to be more thorough and really address some of the challenges. And I have no doubt it is a really challenging environment. So so it has happened, but I think this is probably going to be the best one. So no pressure there for you, Zoe. Just a couple of things I wanted to say. So I really welcome the governance being back on track, or are you going to get the delivery board back on track? Because there have been decisions made about ending some schemes and cutting stuff, which I think have been questionable and they haven't been transparent. So I'll leave that one there, but I'm really pleased to see that will be getting back on track. And it's no reflection on the people who are now running this, because I know you've taken on something that was pretty much running to the ground, I have to say. My comment really is about, I think we're missing a trick when it comes to the voluntary sector investment from the Better Care Fund. So the voluntary sector has about 2 million out of 25 million at the moment. And I think that 2 million is stretched a bit because the council is not a voluntary sector organisation, which some of the lines say that they are. So 2 million-ish out of 25. Which I think is tiny when you look at how much we think the voluntary sector can contribute to prevention, early intervention, keeping people out of hospital, getting people out of hospital. So I think we've got a much bigger role to play. And, I'd be calling for part of this fund to be ring fenced for the VCS, so we can allocate X percentage, which you've heard me ask for before, with lots of different funds. I mean, I think the VCS comes out worse with any funding that goes around. We get a tiny proportion. And at the moment, the VCS is really struggling. We've just got the results of our survey, State of the Sector survey, where half of the charities used reserves last year and will be using reserves this year. 69% only have reserves that last 6 months. So I'll leave you to do the maths. The sector is in crisis, and we really need to start thinking about how can we use them to help us deliver on what we need to deliver on across the whole system. Otherwise, we will lose them and you will have some big gaps. We'll have some big gaps in our services. So I don't know whether we can consider ring fencing a percentage. At the moment, we get about 9–10% from this. So whether we could increase that. And not just this, any funds that are out there, it shouldn't be necessary. And hopefully in 5 years' time, it won't be necessary when we sort of start to see more of an equal playing field.
Thank you very much. And Sian, did you want to come in? Thanks.
I won't say very much because I haven't been that in touch with BCF for a while, and I just think from reading the papers, I know you're getting to grips with this, you're pulling things together, you're doing things differently. There is, as Councillor Webb has already commented on, quite a lot of information and requirements around reporting here. But what was really interesting to me was trying to understand what difference does this make to people, and not to services, not to the system, not to how stretched we all know we are, but actually, do people get the outcomes that they want from what happens? Is support flexible and responsive? Does it meet their needs? I do know about York Integrated Care Team because we get a lot of feedback every month about people who've had that service. And I know from conversations with colleagues, I know a little bit about some of the schemes. But I think overall, there's something for me about how do we get that feel of what difference is this making to actual humans? And also, for me, the Better Care Fund is all about how we do integration, how we work differently to get better results for people. So are we able to show how working in this way together is actually making that difference? And how does that feed into some of the conversations we're having about integration more widely, in terms of things like integrated neighbourhood teams, in terms of things like the hubs? It feels to me like there's a lot of programs that have a lot of similarities that aren't actually all plugged into the same spaces. And that feels a little bit weird to me as well. So I think for me, I'd want to know more about why this matters, how we're forging the path on integration, and how this fits with everything else that's happening. And what does it mean for a person? Thanks.
Thanks, Sean. And I think it's a really valid question. And I think what's different now to maybe previous versions of the BCF or previous years is that we want to add that on as one of our own metrics. We want to hold ourselves to account to make sure that it is making a difference to the individual. You mentioned the York Integrated Care Team, which was the example I was going to give, but we are seeing such a positive difference that scheme is having on not only on our workforce, but on our patients as well, on everybody combined. So I would like to build that in as a metric, even though it's not one of the standard performance objectives, but for ourselves to hold ourselves to account, to make sure that we are actually giving people and residents, patients what they need. So I very much hear you, and it will very much be built in to this, what I like to call sort of, I don't know, a refresh of the BCF or a new way of thinking. And I think Alison's points around the governance, I welcome those challenges. I welcome those questions. We need to make sure that we have got that governance right. We need a proportionate representation. We need to be held to account, and we need to be answerable, because as you say, these funds are not just numbers on paper, they are contributing to people's lives.
Can I just add, what used to happen when the schemes used to report in, they quite often send case studies in about individuals they'd work with and the impacts on those. So I don't know if that's something we could think about.
Yeah, absolutely. Can build that in.
Invigorating.
Thank you very much for that. And I think, yeah, some case studies within that would be really, really useful, because I think when I first looked at that, there was just such a lot of numbers. And I think looking at, so I kind of turned it around to what Sean was just discussing, which is the individuals and how is it helping people and how is it supporting people, I think was where I looked at. But thank you very, very much for this report, and we note the content and look forward to future development. Thank you.
Thank you, Chair.
Okay, so the next item is agenda item 6, and that is my report of the Health and Wellbeing Board. So I will just go through this, pick out some key things that I identified within this, but then please feel free to ask me or the relevant person any questions around it. So the first bit is the report of the Health and Care Collaborative. And the recent focus around that has been frailty, women's health, children and young people, and obesity impact, and the development of neighbourhood teams. I think within that, some things that I found really, really useful was looking at the IDAS, because IDAS came to speak to people within that. And I think with the development of the new domestic abuse strategy, I think what is really concerning is that there's a rise in domestic abuse, and we know that there's massive underreporting within domestic abuse. So I think that was really concerning. The children and young people, the data from primary care that I also saw as concerning was the 3% increase in young people diagnosed with anxiety and depression, or both. And an action was around the RAISE hubs and discussing and looking at future plans, what can be done around the hubs for young people. And I'd be really, really interested to have more information and look at that further in addressing the anxiety and depression in the young people. And most recently, we've been looking at the integrated neighbourhood teams and maintaining a focus on prevention within that. The Ageing Well partnership has been looked at locally to identify priorities for their local health and wellbeing. One of their main priorities was to reduce the proportion of adults in York feeling lonely, and there was some work done around feeling lonely, because although loneliness can be felt by anyone at any age, it was more prevalent in older people, and one of the main goals was to reduce feeling lonely from 25% to 20%. And despite having a lot of social offers, people in York did feel quite lonely at times. And so there's been a studies done into why it was and about what was on offer in York to around people feeling lonely, and the expectations of social engagement. What came out of that study on doing similar cities was that expectations of social engagement are high in York. I'm not saying there shouldn't be. Absolutely, people should have high expectations. And it's a lot of it, I believe, is probably around communication and getting out there what is around and about. And then the school and wellbeing survey, I think the main things from this has been discussed before, but I think we've got some more coming up from it that concerns that only 53% of young people have seen a dentist in the last year. Concerns around the difficulties getting a dentist. Really looking forward to see if there's any changes in the near future to young people getting dentists and changing this. And some questions that I previously asked around the school survey about how it was done in schools and how it was handed to teachers. Wondered if anywhere in the future it could be done almost like a ballot box style, where young people put their things in, and also looking at some possible way in the future of capturing young people not in education. The neurodiversity programme, which consists of two projects, which was the ADHD Foundation charity project that the council funded, and the Partnership in Neurodiversity in Schools, which was Department of Education, but funded by the ICB. And this was to enable young neurodiverse people to be able to participate more fully in education, more fully in the classroom experience, more fully socially, and looking at a strength-based approach for inclusivity for these young people. So within this, there are 9 schools identified, and the courses are going to start being delivered equivalent to 5 days a week. Well, they were from September 24 to 25, so that is in process. The SEND needs assessment. Now, within this, they spoke about the I am statements. I've really struggled to find the I am statements, and Councillor Webb had to help me in the end, but I have found them now and I do understand them. But it would be, I don't know, really useful if they could be put somewhere that was really obvious what they were, because I got a whole load of strange stuff when looking for the I am statements. So within that, there was also the survey that was quite concerning, that said 31% said their experience of seeking support for SEND was quite poor. So yeah, there was but I do understand the I am statements now. And within SEND, really interesting, and I'm really interested to see if the Youth Justice Service are doing some further work around this. There was some research done about 80% of young people who had been diagnosed with SEN who received a custodial sentence had been diagnosed with SEN at some point. Really, really interested, because the Youth Justice Board are monitoring that. I'm really, really interested in seeing the outcome of that, and some analysis of those results. The new drug and alcohol service in York, so that was previously run by Changing Lives and is now run by CGL. So they will have all the recovery-based stuff, all the clinical-based interventions as they did previously, and also still continue to provide harm reduction services for people who aren't ready to maybe make major changes in their life yet, but still want to access services around safer use or needle exchange, also services like that, which are there for people until they wish to make changes in their life. And that service does provide, also does have a young people service, which is available for young people under 25 who are using substances or affected by somebody else's substance use. Health protection, there's a bit in the report about vaccinations and just seeking vaccinations. And yeah, the health trainer service, worth saying, massive well done to the health trainers, because in the last year there's been 1,152 referrals and 86% of the referrals achieved one of their goals and 67% achieved all of their goals. Really, really high record of success. That 660 people who were referred to stop smoking, 331 set a quit date and 72 successfully quit at 4 weeks. Really, really effective data and effective interventions around stopping smoking. But it is worth mentioning the health trainers also offer advice around vaping, healthy eating, weight management and lower level alcohol use. So yeah, that was just really, really positive for the health trainers. And I've probably gone on way too long. So if anyone would like to ask any questions, that would be great. Thanks.
I think the thing that concerned me most in the Children and People survey was less than half of people thought telling you what to wear, checking where you are all the time and being jealous is always wrong. So only a half, which red flag for me around domestic abuse. So I'm just wondering, are we doing work? What are the signs like coercive control and all the rest of it? So are we doing stuff in schools around violence against women and girls? Because I think that's where that sits, isn't it?
Peter, yeah, thank you.
I could come back on that. Martin also might have comments. Come back on that, which is that two things there, Alison. First of all, the council commissions the Children and Young People service from IDAS. So Councillor Stills-Walshaw mentioned IDAS as our domestic abuse provider. So directly supporting children who are both victims of domestic abuse or victims through witnessing, because of the new legislation a couple of years ago. You are now a victim if you're a witness of domestic abuse. So that is an aspect of it. The Healthy Schools programme also has is getting stronger and stronger take up in York. I think we're now at 25% of our schools are working towards Healthy Schools programme awards. Within that is material in terms of some of the strong sort of clear boundaries within relationships and where to get support, appropriate behaviour, and it is also going to be part of the curriculum around relationships and sex education as well, and part of an Ofsted assessment on that curriculum is about health and wellbeing as well. For the last few years, there's been a health and wellbeing component. It's probably not perfect, and that data, I agree with you, is really concerning. And there's something a little bit about statutory and other services fighting against a bit of a rising tide with some of those trends, because as many leaflets as can be distributed and lesson plans which incorporate what we'd hope would be safety messages, for every one of those, you might get 100 unhelpful or downright awful TikTok videos that are flooding into the lives of children and young people. So I'm not going to claim that any of that work is necessarily making the difference we all would feel it needed to, but there are pieces of work that we are trying to do, and it is increasingly a public health concern for me.
Thank you very much. Did anyone else have any comments? Councillor Webb?
Yeah, I'll just follow up on that comment. As you all know, I think in my other world, I am a school teacher. And just to confirm, yes, this is something that happens in schools. It is discussed. I'd agree with what Peter said, that sadly, as much as I love my powers as a teacher, I know that I can't combat the might of multi-billionaire companies such as Facebook and things like that, and TikTok and all the rest of those young people things. But that is something that's taken very seriously. And I think that it's a real, we need a change in culture nationally, internationally, probably, that would make a big difference, because I think we're just storing up huge problems for further down the line, really. I think that just following up on something separate and the I am statements, and I think it links directly to what you were saying, Councillor Seals Walshaw, about 31% seeking support for SEND, struggling to identify where to go for help. If you're in a situation where you are a really stressed parent, as I'm sure pretty much all parents are stressed constantly, and then a situation arises where you are suddenly having to find out lots of new information, making it as obvious as possible where to get that information is really, really challenging. And I think that's quite evident that we have quite rightly, I think, a separate sort of website almost for our SEND local offer. But that does mean that it's quite tricky to find if you've never experienced and never had to look for anything like that. And that first step in is probably the most challenging, which is why I'm quite glad that we're making moves really at the council. And maybe Martin, you might want to talk more about the SEND hub to sort of try and provide a face to that ask, because I think that's really important. I don't know, Martin, you do want to come in there.
Thank you. Yes, I will do so. Although it's yet to go to executive, but
yeah, we've not decided it yet, but I'm quite pleased with it. So I just keep going.
But I will share. We are looking to extend the local offer, which is a web-based offer of services, which does explain, I think, extremely well the support that exists in the city on the whole. That's not to say that it isn't difficult for parents, and I think some of the issues aren't necessarily about what you can find. It's about the fact that you've got a public system, and this isn't about local authority. It's about a whole system, public system that is short of £6.4 billion nationally. That's what we would need to deliver the 2014 Act around SEND. However, in York, I think what we are developing is a physical hub under the umbrella of Raise York, the family hubs. Is to develop a SEND centre of excellence, what we call centre of excellence, but that's a way of describing it, where we bring together professionals right across different organisations, where there will be far better support for families. We hope that both SENDIAS and the Parent Carer Forum will be absolutely central to that SEND hub. In fact, Parent Carer Forum, we'd expect, will actually run the front part of the building, so they provide the welcome into the building. What it will do is, I think, is help get professionals together to develop new approaches and new thought about SEND, which is a really complex world where we're still developing an understanding of how we deliver support around things like neurodiversity, which is extensive, growing, and something that we are many, many years behind when it compares to sort of physical health. There's a lot for us to do in terms of catching up.
Can I just sort of add further to that as well, as I think that the Parent Carer Forum, SENDIAS, they are involved, as we said, with the decision hasn't been made yet as to what we do. This is still in process, and those organisations and other charity providers, things like that, are involved right now in developing what happens next, so that when it hopefully does get going, it's in the best possible place it can be to start with. Will it be everything? Will it be a panacea? Probably not. Will it help? I hope so, with the right inputs that we're having now, but that's sort of where we're moving towards, hopefully.
I think one of the things we hear often, sorry to just come in on that, but I think one of the things we hear often from parents is when you are first starting that journey, actually what you want is someone to walk alongside you for a little way. And a website can't do that. Websites are notoriously poor at walking, but human beings can walk alongside each other when you're beginning this. So I think that ability to know there is somewhere you can go, wherever located, and actually walk in and ask a human being things will be really helpful.
Just one last thing. I sound like Columbo there, but there you go. If you go back to the Poverty Truth Commission point that we had earlier on, where one of the things that people were talking about was talking to people with kindness, clarity and ease of understanding. That's what all this is about, isn't it? And I think we shouldn't forget that.
Thank you, Councillor Webb, and thank you, Sian and Martin, for your contributions. Absolutely agree. It is about understanding, having people there, and I was really interested in hearing more about the hubs and things and how they're going to work. Is everyone all right if we move on to the next one, which is agenda item? Oh, sorry, Councillor Mason.
No problem. Loads of interesting things in here, I think, and hopefully useful for all different people in terms of picking bits out, particularly the young people's health stuff. Probably for Peter, I just wondered why independent schools are not covered by the survey.
Thanks, Councillor Mason. We have generally worked through the school support team and school relationships that we have in the council, which I guess are that little bit more developed with those within the state sector, but there's absolutely nothing to say that we couldn't extend to independent schools. Obviously, independent schools are teaching residents of the City of York that are children, young people in our city, and we want to know about their health and care needs too. So that is something we could look into, seeing how we might go about doing that. I guess just purely from an administrative point of view, I guess it would be bilateral with each, which just causes a little bit more sort of admin work than being able to go out generally to primary and secondary. So we look at how we might pick that up. And I would also pick up a previous comment as well around children who are homeschooled. I think there are over 200 children now who are outside of educational settings, and again, would like to do that. It's one of those, the more you go into the smaller groups within the city, the harder it gets to be able to get that data out. But I think it would be a really important way to develop this in the future.
Yeah, I suppose there's probably a small group of people there as well. You were saying as well that we may be from York, but we located in a different area for whatever reason in terms of capturing their information. Again, would be really useful.
Thank you. Okay, so if we move on, are we all right to move on to agenda item 7, report of the Health and Care Partnership? Thank you, Sarah.
Thank you very much, Chair. A bumper edition, I think it's fair to say, this time. As I was reading through and rehearsing what I was going to say, I thought, I'm going to have to be a bit choosy, I think, with my time, and given how time's ticking on as well, I will be choosy, you'll be glad to know. So what I'm going to do is just draw members' attention to the work of the York Health and Care Partnership in two regards. One, the annual report and joint forward plan, which is part of your pack today. I think that's Appendix A. And then just talk you through some of the highlights from the last 3 meetings, again, of which you've got the minutes from those meetings in April, May and June. So first of all, just to thank all of my colleagues across the York Health and Care Partnership and the Place Executive Committee. I think particular thanks to Anna Basilico in our Place team, and to Sian as well, who's just sat down, he'll be surprised, but for just helping us with the language around our annual report and joint forward plan. So you can thank her for hopefully the fact that everything does make sense in that. But I would just encourage people to read that. It's our first annual report and joint forward plan. It's not a statutory requirement because we're not a statutory committee. It's there because we wanted to share with the people that we serve, our public and our colleagues here today, in terms of the work that we've done as a partnership. In that annual report, it includes the engagement work, for example, that we've done. Healthwatch are a key strategic partner, and you'll see that later, a real asset to our city, but also a real asset to our partnership and our board. There's a summary of the engagement work that has been done, and the sort of additions that has brought. There's a section around the work that we've done to address health inequalities, with a particular case study in there around children's and maternal health, and also setting out the work that we've done really comprehensively around delivery against our 6 priorities. So themes in there around our work around multi-agency hubs in frailty, crisis and discharge. Raise York, we've heard about before, the work around our family hubs and our mental health hubs as well. Move to virtual hospital care, which we don't often talk about as a board, but it's quite interesting in in terms of things are moving on in terms of the amount of care that we can actually deliver in people's homes, as well as in care homes, actually, to avoid people, particularly people who are particularly frail, having to traipse into hospital for care. And hospital, as we know, is not always the best place for people. They can pick up stuff when they're in hospital. So virtual hospital care, which is under the care as hospital specialists, integrated urgent care between hospitals and GPs, better connectivity this year than we had last year between GPs and hospitals for elective care, not having to be referred. If there's a question a GP has, they can ring, they can speak, they can work as a team. Work as well around addressing pathways for children between health and public health and schools, showcased in this report, and also work embarking around workforce training and skills, starting to look at student placements and how we think in a more integrated way. Why not have student placements in our mental health hubs, for example, in our frailty hub? Wouldn't that be fantastic? And starting to bring that into the fore. So our plan continues in 24-25, and again, you've got root and branch description of what work we will be doing over the course of this year, and indeed that work has already started. So annual report is there available and will be published on our website as well. In terms of then the meetings of the last 3 months through April, May and June, I'm just going to pick out a few key highlights really. I want to make sure I leave time for some discussion, but there is a real theme here in terms of the work we are doing to shape our future, the work we are doing to shape our place. And health and care and prevention really should be looking different at the challenges that we are facing together, many of which we've talked about today, and how needs are changing and how the population is aging. And unfortunately, the burden of ill health is also increasing. So we have to do things differently. And we have a real responsibility as a York Health and Care Partnership to build the place that will deliver on our health and wellbeing strategy. You know, that's, you know, in terms of shifting that sort of way that care is delivered for a healthier future for our future generations and our children of today. So that is the theme really in here, and you can see in the April meeting starting to look at the very fabric of our city, the way that we're set up around localities. And whilst the City of York Council is leading the work around locality models, how our multi-agency workers get around that, get behind that. So often we see general practice having its own model of care, and community health having its model, and children's social care and etc. having their own models. Everyone is going to get behind this locality model, which is a real sea change and a real opportunity, so that we move towards a model of multi-agency integrated teams around, whether you call it local areas, whether you call it neighbourhoods. Apologies that both are referenced, but essentially it's the same thing. And I'm sure we'll pick one that we like best. But important that we're doing that work. If we think about some of what we're seeing in national government, the desire to trial neighbourhood health centres. Wouldn't it be fantastic if we get ourselves organised so that we could be, you know, an area that trials a new neighbourhood health centre model. So really important work. We talked, I want to flip over to the page and look at the June meeting where we talked about the future of our population, and as I said, these challenges that we have in terms of ageing population, a greater burden of ill health in our communities, and that directly impacts on our services. It means more people accessing or trying to access general practice, our hospital services, more people recovering from illnesses such as stroke, many of which could be prevented. So that integrated prevention work, we spoke at length about that at our June meeting, and we talked about the health trainers earlier. And I think what we sometimes forget is that these services that we have in prevention, and we have a considerable amount of resource as a partnership in prevention in our voluntary sector, general practice services. How do we know we're getting the best value for money out of that? How do we know that we are preventing those strokes and those cases of COPD and dementia, etc.? Because it has a very, very real impact on people, and sometimes we can forget that. So work that we'll be doing this year around integrated prevention and really looking carefully at those resources and how we can maximise, and again, be ready for future investment, be ready for investment in primary and community care services, and making sure that it's targeted to those right services and the right populations. So one of our other themes in how we shape our future, how we shape our place, is about having core offers, yes, but also having targeted offers, and be really, really clear about using our data. And our Population Health Hub is always referencing here doing fantastic work, and our Population Health Hub is part of that prevention resource. And again, as a place partnership, we've talked at length about how we start to move away from purely universal and starting to look at really targeted offers. We know the interventions that work, and we have a responsibility as a partnership to focus those interventions on the people who stand to benefit the most. So that's what that prevention and population health approach is all about. And then in the May meeting, so a little bit back to front, but essentially all that has been brought together in a future delivery model. So we're starting to develop a narrative that describes this future model of healthcare and prevention. And we've had a number of workshops as a partnership over the summer, bringing professionals together to co-design what that could look like. Early days, but again, we'd like to share more on that and bring all these things together in terms of through this board and through other forums with our public around how we're shaping this future. So long-term, big transformation, but important work. Have I covered everything that I wanted to cover? Probably. There is, we did also talk about the NHS performance at the end of the year at the June meeting. I think there's a number of highlights there. I think the key message from NHS performance at the moment is better, but still not where we want to be by any stretch of the imagination. We are still in recovery, I think. We are doing far better. We have seen improvement in the A&E waiting times, but you'll remember where we were several years ago, and 78% doesn't sound so great, does it? And we've got a series of immediate recovery plans in place that we've been working very hard on as a system across health and social care, but also within the hospital environment to improve time to see a clinician, for example. And general practice as well. I was quite staggered by this, 200,000 appointments in April by York GPs, just York GPs. You know, it's a huge number, and it's a good reminder that 90% of our activity is actually in general practice. So having that working as best as it can, and we are outperforming the wider patch, which is good news. So that work in terms of waiting times and access does continue, and we do seek assurance about that as a place. Finally, just to mention the York Mental Health Partnership and the great work that we're doing there, and Brian's here today on behalf of Tube, and we've got Sarah here for City of York Council in terms of the approaches that we're taking. But you'll see in here that there's some really exciting work nationally going on around funding 24-hour community mental health centres. We were able to launch our community mental health hub at 30 Clarence Street. And we discussed that as a board, and also building on that. So that's now launched, but also now being able to respond and bid for some national monies, which aren't inconsiderable. It's a decent pot of money to be able to develop a 24-hour mental health centre in York. So I'm not going to say more. That we should hear very, very imminently in terms of being able to share more about that. Not quite yet, but very exciting times for the partnership. So thank you very much, Chair.
Thank you very much, Sarah, and thank you for this really comprehensive report, which is really, really clear with its priorities and with the forward plan that they're continuing to work towards. We're really tight on time. Can we have about 5 minutes for questions if anyone's got any? Councillor Runciman.
Thank you, Sarah. They were interesting. I did read them all. It took me quite a long time. It was well worth it. Two things I want to ask you. On page 77, you're talking about appointments. And I wondered, are they hospital appointments? Are they GP appointments? Are they appointments that are by phone? Or what appointments does that include?
So can I just confirm that's the reference to 119,917 appointments in the, yes, it's general practice appointments. So all general practice appointments in York in April.
So when my residents say they can't get an appointment, and then I find that they've actually spoken to somebody on the phone, is that included in your percentages?
Telephone appointments is included in the 200,000 figure there. Yes. Yes.
I've just as an aside, I think people are getting used to the fact they might be rung up, but it's still a bone of contention. And then on the next page, 78, the workforce. Can you give us a sentence or two about a recruitment and retention, whether it's going up, going down, whether it's steady? Just tell us a little bit about that.
It varies, I think, across the sectors and organisations that make up the partnership, and I suspect it's different for each organisation. I think what it's fair to say is that retention is the new recruitment. We've got to do better at holding on to our staff because we struggle. We do struggle to recruit, and it's a key issue for us. We often find that whilst money is a big issue, actually, even if you have the money, finding the staff that can actually do those roles is often the bigger battle. So it's, in terms of is it going in the right or wrong direction, I don't think we've got the data that would tell us sort of across all organisations, all services, because each service is sort of in a different position, really. We don't count it in that way, unfortunately, in terms of that data, but there are challenges, I think, in probably every sector and most services.
Yeah, it would be useful to have that. I realise the complications of getting the data, but if we're going to get our services in the community and our services, the tier 3 services working properly, we have to have the right number of staff with the right qualifications, don't we?
And we do have, if I may just come in, that we do have the report actually that came to the place board. So what might be worth doing is actually referring to that you haven't actually got the report in here. There was quite a good report that just set out with some numbers. As you've said, it may not be as comprehensive as we would like because not every sector and service is counted, but it would give a flavour, I think. So let me take that as an action.
Thank you. Okay, did anybody else have any comments to make? Nope. I just had one comment, and that was on the A&E waiting times, and that the goal was 78% having a wait of no more than 4 hours by March 25. I just wondered, do we have any indication of where we're maybe up to with that? Thank you.
Something I spend an awful lot of time on, Chair. So we've just actually, as we almost just before, I think it was the last thing I did before I came into this meeting was just check the A&E trajectory. So for York and Scarborough Trust, and particularly obviously my focus being around York Hospital, we've just updated our plan. We were a bit off plan. I think around the sort of 70, we're hovering around the 70% mark at the moment. So we're not too far off, and it has improved. So where we were last year, we have seen significant improvement. So everything's going in the right direction, but we can't normalise where we are. If we do, then you start to see improvement as the goal, and you lose sight of where we need to be in terms of good standards. So we've just revised our trajectory because it wasn't quite where we wanted it to be able to do exactly what we said, which is achieve that standard by March 25. Yeah.
Brilliant. Thank you very much. And thank you for the report and the work within. Okay, if we move on, please, to agenda item number 8, and that is the Healthwatch annual report and updates on recommendations. Thank you, Sian.
Thank you, Chair. Some of you may be aware that when the Healthwatch York contract was put out to tender in March, local press originally reported this as it being renewed, having misunderstood discussions at the council exec. Before the article was corrected, the news that we'd secured the £462,000 contract elicited the following comments. Wouldn't nearly £500,000 be better spent on doing something tangible rather than report writing? Rather than unsubstantiated praise, it would be better to see some detailed cost-benefit analysis for this service to justify the significant spend. Facts and data, please. Correct. What improvements have they made? None. I'm not going to lie, it wasn't the easiest thing in the world reading those comments, but as we spend time in this space and others sharing often quite difficult feedback with health and care colleagues, I thought it was really important to reflect on that feedback. What it says to me is that there are still people out there who don't know what we do or don't see the benefits of what we do. And therefore, I'm bringing you our annual report, as I have to do, it's a statutory thing. But for us, we produce it every year to try and explain a little bit more about what our responsibilities are as a Healthwatch service. So alongside the headline reports, like our Breaking Point report on mental health crisis care and the work on the adult ADHD and autism assessment pathway, which are the result of extensive engagement with people living in the city to understand their experiences and their concerns, we also share a lot of information about what our day-to-day work looks like. This isn't something that we talk about a lot in meetings. It's not something that we kind of get to talk about publicly very often, but it includes our information signposting and advice service, which helps people navigate the health and care system, find services and support at times of need. And we also log their feedback about health and care services and what they're experiencing day in, day out in the city. It includes the work that we couldn't do without our volunteer support, like our readability panel that has provided extensive feedback to improve the quality of a vast array of NHS and local authority leaflets and information resources. It includes attending a long list of meetings, both in York and across the wider Humber and North Yorkshire Integrated Care Board patch, to make sure what we are hearing from people in York is heard and understood by the system. So I really hope you enjoyed reading our annual report, and I hope you can see from it how hard our small team has been working to try and make a difference. We receive just £115,610 per year through our core contract. Most of this is spent on our staff team, now just 4 people, all of us part-time, working to deliver the statutory responsibilities as the local Healthwatch for the City of York Council area. I'm quite happy to be wheeled out as the face of Healthwatch in York, but I'm very aware that actually most of what I talk about is the work of my amazing team. That's Rachel, Roger and Ruth, who work incredibly hard every day to make sure we always have plenty to contribute to health and care conversations. We're also supported by our team of 33 volunteers who give us the gift of their time, skills and knowledge, with a number having done so for very many years. We really could not do as much without their support. Our reports mean a lot to us, sharing what we've heard from local people to press for change. But they're not the most important thing we do. The important bit for me is how colleagues around this table work together to take action on the issues people raise through us. We've attempted to capture these through the report on responses to recommendations. So I would just ask the board to consider whether that report provides the assurance needed that sufficient progress is now being made in dealing with local people's concerns. I do apologise as well for making the Health and Wellbeing Board papers this time backbreakingly heavy. I know we shared not just our annual report and the responses to recommendations, but also our independent evaluation and our summary work plan. I'd really like to say to those who took part in our independent evaluation, thank you for helping us understand what you value in what we do and for giving us plenty of food for thought in what we do next. So that's all I'd like to say, but thank you.
Thank you very much, Sian. And I just wanted to say, when I read this report and saw all the stuff in it, I was shocked that you have 4 part-time members of staff, because there is a huge amount of work within that is absolutely brilliant. What also struck me is how easy your reports are to read, and that they're really, really understandable. And that's brilliant, because it means that they are accessible to everyone who wants to read them. So thank you very much. And I will ask if anyone, Councillor Runciman.
One quick comment, Sian. A noble soul from Healthwatch stood in a field and I watched her, because the stall where I was running was the stall on the other side, hers, in a not very clement weather, I'm afraid. And she nobly talked to people to spread the word about what Healthwatch is. She didn't have a lot of customers, but then it wasn't the best weather to having customers. But she was there and she was talking and she was explaining. And that's exactly right.
Thank you. Councillor Webb.
Councillor Runciman, I think you've got to explain. Was there anybody else in this field? Or is it sounds slightly ominous that. Sorry. Sian, never read the comments. It's never a good sign. I think councillors across the chamber, shall we say, never read the comments. Should see the ones about me. I particularly like in the report, I mean, the fact that you almost start with this idea of the tale of 2 cities, this inequality. I think it's so important to highlight that, and I'd agree with what's been said so far. It's a very easy report to read, with some hard messages in it. Just focusing on something particular, in your achievement section, you mentioned the core 20+5. And I wonder if you can just give us a little bit more detail about what's been involved in that, how you've been involved. I know it was mentioned in a previous report as well. So if you wanted to come in as well, Sarah, on that, that might be nice.
Yes, of course. I mean, we will talk about it much more in next year's annual report. So spoiler alert. What it is we've received some funding from Humber and North Yorkshire Integrated Care Board, which is their money and NHS England money. And originally the scheme was only going to run in coastal areas across Humber and North Yorkshire, which obviously York is about as far from a coastal area as you can be. But they found a little bit more money and we are now able to be part of it. So we've started late, but we've been working on recruiting young people aged 16 to 25 to have conversations with other young people about what matters to them in terms of health and social care, how easy they found it to find things. I was interested actually when you were talking about dentistry earlier, picking up some issues around things like that, but also cost of living. What does this mean for young people? And also asking some questions that Peter has chucked into the mix about things he'd like to understand about York as a health generating, health promoting city. So really, we only got started having conversations, long, detailed conversations with young people about 2 or 3 weeks ago. We now have 10 Core Connector volunteers. We've recorded 27 conversations to date, and we are having many more. But if any of you know groups of young people who would like to meet with one of our Core Connectors and talk through their experiences of health and social care, please get in touch with us. We are more than happy to come out. Happy to work with anyone on that. We're particularly keen to make sure that we're hearing from basically anyone in York who is young and has something to say about health and care. And it is all connected with the core 20+5 young people's priorities. So it's around oral health, mental health. I'm going to get these wrong, so I'm looking at Sarah to correct me when I do go off piste. Epilepsy, asthma, and the diabetes. Yeah, you've read my report. I knew. It's just checking, just testing you all. But we're using it as an opportunity to explore sort of wider issues as well. And we're getting some really interesting feedback that is giving us some food for thought in terms of what we do next, and picking up some of the issues we've already touched on around neurodiversity, also around gender identity and how prepared we are as a system for. I know, I was having a conversation with young people about gender identity and sexuality the other day, and I know I'm a dinosaur, but I think our health and social care system is possibly a little bit Jurassic as well. There is work to do in terms of being ready for making sure our young people get the services they deserve, to make sure we're supporting them. So I hope that helps.
Martin, did you want to come in on that?
Yes, certainly the offer of finding some young people, and I think just to give an example of how powerful that can be, we recently brought a range of young people together to meet with some very senior colleagues in the ICB and the local authority who were care leavers, care experienced. Some of those young people were from York, others came from different parts of the ICB area. As a result of that conversation, what was really strongly coming across from those young people is the shift from mental health from young people to being into an adult mental health system at the age of 18. As a direct result of that conversation, and York young people, York led a bid and through the ICB on a project to develop a central ICB clinical psychologist with an apprenticed advanced clinical practitioner to sit in each leaving care team across all 6 areas. And we were fortunate to win that bid, which brings us to 1.5 million, 1.4 million to trial a different approach to mental health, particularly between 18 and 25. So I think it's really powerful stuff. And actually, some of this challenge, how if it costs a few $100,000, the reality is it generally brings a lot more money into the system. So I think the work is fantastic.
Peter, did you want to come in?
It's a very good question. I'm really happy to almost get the results by email, Sian, rather than take the time up. But it was just about next steps and future reports. And I wasn't entirely clear, and I'd like to see exactly what within this, the sort of the your anticipated reports over the next year. But I was going to pull out one thing, emerging issues, say gender and health, and just to note that we are looking at doing a health needs assessment around women's health, and then following up with trans and non-binary health and men's health at some point in the future, but starting with women's health. So it'd be good to make those connections, but also to understand if there are other topic areas looking at picking up.
Okay, so I mean, it's always a bit weird because our annual report is actually up to March of this year, and we've already started the work that we're not talking about in this. So our next report will be our interim report around access to GP services. We received over 1,300 responses to that. The report is drafted. We need to fact check it before it gets published, but I anticipate, hopefully, if there is space on the agenda, we bring it to the September Health and Wellbeing Board. No pressure, Chair. If we can squeeze it in, that would be lovely. We're also beginning some conversations with people around feeding into City of York's all-age neurodiversity strategy. So we're beginning to think about how that might look, and we'd be delighted to work with you around gender health and how what we do feeds in most effectively. Also, fairly recent news, we are being given £4,000 from Humber and North Yorkshire ICB to have 5 conversations with women in depth around sexual health and reproductive health, which I think will not only be useful for them at ICB level, but may be instructive for some of the work you're doing for the JSNA.
Got my email.
Happy to share.
Thank you. Councillor Mason?
Thanks. I suppose it's an obvious one, and I think it was already in your plan around students and kind of being able to access GPs and things when they're moving between residencies. But obviously, clearly, a huge amount of our population between that kind of 16 to 25 bracket is both universities. So hopefully, there's some work there that can be done to pick up their kind of very transient lives and health needs.
We are delighted that a number of our core connectors are actually university students at one of the higher education places. I think there's one in each of the main universities in the city. They are not beginning their work until they come back for that term. So they're already kind of trained and ready to go. And we think that will be really useful in terms of getting a better understanding of student health and what's going on. And 2 people who are currently core connectors are also at York College and are beginning conversations about how they have some conversations with their peers when they go back in September to feed that in as well. So I hope that's reassuring.
Yeah, I'll ask him, Brian, if you can get anybody there, because again, they've got a slightly different focus in what they teach, and it brings a slightly different demographic as well.
Thank you. And thank you very much for this annual report. Can I just ask, because I know we were asked to consider the annexes, and it was just one thing under annex, the pathway for adult ADHD and autism assessment. I think it was E7. Just wondered, it's the strategy for neurodivergent people, but we're calling it the all-age autism strategy. It says
Sorry,
autism.
all-age neurodiversity strategy.
Under E7.
Yes, I think it's because originally we had an all-age autism strategy, but there has been a decision now through the exec that it will be an all-age neurodiversity strategy. So when we made the recommendation, that decision hadn't happened, but now it has, if that makes sense.
Thank you very much. Okay, that's great. Thank you very much, Ben. Okay, so I'm sorry we're a little bit behind, but can we move on to the final agenda item number 9, and that is Peter on goals 8 and 9 of the Joint Health and Wellbeing Strategy.
Thanks very much, Chair, and I can be really brief about this report. So we obviously have our strategy. We obviously have 10 population health goals. People will sort of be let me talking about these goals, really clear, evidence-based things that we think will close the gap between richest and poorest communities in terms of healthy life expectancy, which is our big vision. And of those 10 goals, we go through a number of them each time. Sometimes we take just one, sometimes we do 2 or 3. This time round, we've got all the way to goals 8 and 9, so we're almost through, which is really brilliant. And the idea is to present board members with the data that lies behind the goals to see how we're doing from a data perspective, but also some narrative about some of the actions on it. We focus in at goal 8 on early diagnosis, and these are around some key disease areas. Just to give you an idea of sort of scale here, we're talking about 11,000 people with diabetes, 33,000 people with high blood pressure, 2,000 people with dementia, 10,000 with 5-year incident cancer in the city. So seriously big chunks of our population that we're talking about these diseases cover. And they were chosen because with each of them, York, fairly surprisingly perhaps, actually doesn't diagnose early at very high rates. We are generally below the average on all of them and have been for some time in each. Each of them we model an expected number of people in the city that have them, and our numbers are lower than the models would anticipate. So there's narrative against each of them. So I won't go through them in turn, but there's narrative against cardiovascular disease with, I think, some really exciting, innovative stuff that we're doing around the Health Kiosks project, but there is plenty of other cardiovascular disease work. This is just, I guess, an illustration of some of the work. We have a whole CVD program, and primary care obviously do a huge amount in that area. Some narrative against the action around diabetes and targeted health checks. And I think this is one of the areas, if we'd written the strategy again, we probably would have changed the action a little bit, because actually through our health checks, only a small proportion of people are screened eligible for a diabetes risk assessment. It is part of the risk assessment, but only if you screen for it, essentially, if your risk score is higher than 10%. So we don't have brilliant data on that to show you this time around, and we're taking as an action to get better data for you next time on that. Dementia, there's hopefully some really good updates on the Dementia Steering Group, which is collaborative between lots of voluntary sector partners and statutory services around dementia. I think it's fair to say that our dementia diagnosis rates are still not rising, and that has been something we've talked about before as a board and something that is of concern. We have been doing some work to look at that data a little bit more, because there is a suspicion that the model on which we base how many people should be living with dementia in York doesn't take into account some of the risk factors, which actually we do a little bit better on. So we may actually be beating ourselves up a little bit too much about our diagnosis rates. It may be that the estimated rates are not as high, and therefore our actual versus estimate is not as bad. So I've put in there some work the Population Health Hub have been doing on that, and happy to bring that back. But still, I think it's fair to say it's probably 50-50. We probably are not finding early cases of dementia as early as we should. And we know that that will be a combination of public awareness of cognitive impairment and dementia and brain health, allied to what we know are delays and ways in which the system doesn't necessarily diagnose people as quickly as it could, both the journey through primary care to memory services. Cancer diagnosis, updating a little bit, and if Simon were here, I would have brought him in, but Simon provided some data on the faster diagnosis standard. And we're a bit of a strange mix, York, in terms of cancer screening. There are some screening programs we seem to do really poorly on, and others we seem to be sort of best in class. So I think there is probably something about understanding how we are promoting screening for the 3 cancers and AAA, which are national screening programs, plus other targeted screening programs like lung health checks, to make sure that we are helping people take up that free and life-saving offer of screening where it's indicated. That's really important. Our public speaker talked about goal 9 a little bit around physical activity, and I absolutely agree. We deliberately focused this goal not so much on helping individuals to get a bit fitter through going to the gym, which might be a typical way of thinking about this, but actually it is about a whole city approach to getting active and how we help people to move more. Our statistics are quite good as a city, but could be better. And we're still talking about more than 1 in 5 of our population essentially living a sedentary lifestyle, not reporting any physical activity in a week. And we know exercise, physical activity is the pill that every clinician would like to prescribe. It's so universally good for every aspect of health, whether bone health, MSK, your cardiovascular system, mental health, etc. So we are developing a playing pitches strategy for the city, which is a planning tool. And I acknowledge very much what the speaker said about, some of our city parks, if we had £1 million more, would be designed in different ways and have more facilities. it's a really pressurized bit of the public sector, doesn't evolve very much, which you call statutory. So I think, you know, we have a real patchwork of play and parks across the city. And I think it's probably about us all working together, because only, I think, around half our play parks are council owned, half are through other organisations and facilities and community groups. Sometimes it's about supporting those community groups as much as it is the council's facilities. But on the council facilities, we are looking at this strategy as a way of defining some of the best practice when it comes to what our parks and green spaces look like, and particularly probably where we've got the most influence is new development, and thinking about Abington Garden Village, thinking about York Central, thinking about a number of different places and what the green space looks like in them. And actually we have the power to do that essentially for no statutory sector cost, because developers would be putting that provision in. So that's where we're really focusing our key efforts, I guess, is about the new green space that would be coming in. And I will just make a shout out at this point for some really innovative work that has nothing to do with the council in York around Make Space for Girls, and the work at Roundtree Park, trying to make sure that maybe the fairly sort of male-oriented way that we've designed our parks in the past is reoriented towards spaces which encourage girls to take physical exercise and activity and just get together and be together. We know actually that many of the facilities that we have in place don't encourage that, and fantastic work that they've done in Roundtree Park with built facilities, but also a big Make Space for Girls festival, which was in June this year. Some really innovative stuff happening in York that I think really helps contribute to this. And I'll end there, Chair. Thank you.
Thank you very much. And I literally wrote down Make Space for Girls as you were talking, because it's so important that we have those specific things. And they're not expensive. They don't involve massive change. It's really, really simple things for girls and young women in parks. Thank you. Did anybody want to make any comments? Sian?
I just had a question around dementia diagnosis, and when we previously did some work around this, one of the messages we received from people who were seeking or had been through the diagnostic process was that they actually came across a lot of resistance from GPs and other medical professionals in terms of diagnosing dementia, and some real reluctance based on the idea that there's not a lot you can then do for people, which people with dementia were saying was absolutely not the case. And actually getting the diagnosis was the gateway to accessing a wide range of voluntary and community sector services and support. And often they didn't then engage again with statutory services for many years. So I think there's a question for me about, do we understand whether or not that has changed or that continues to be the case? Do we believe that there are still people who are reluctant to give people that diagnosis because they don't feel that it's helpful? And if that is the case, is there anything we can collectively do to help raise again that actually for many people that is the beginning of support and their life feeling better and them having more choice and control over what happens?
I'll come back briefly on that. I think we're missing our GP to be able to answer that in a really considered way, Sian. So I guess Emma would give a very good answer to that. I guess we'll make one small point, which is that therapeutics around dementia are at lightning pace in terms of innovation, and actually some recently trialled and I think soon to be approved by NICE new drugs which are really game-changing when it comes to slowing down progression. So I think it makes early diagnosis even more important from that perspective, because as you say, potentially 20 or 30 years ago, we would have said, well, what can we do from a clinical perspective? Actually, the answer is now actually quite a lot. So I think that becomes a more acute issue, but the extent to which that's still something within primary care, I'm probably not the right person to answer that bit, I'm afraid.
Thank you. Does anybody else want to? No. Well, thank you for those two updates. Oh, sorry, Councillor Webb.
So I'll be brief. It's on goal 9 and what public participants said, and I think you're right. I mean, if the council suddenly had £1 million extra, firstly that would just go into the adult social care overspend. So if we had £40 million extra, that would just go to dealing with the council's budget. But if we had £50 million extra, so we'd have £10 million that we could actually spend. You really wouldn't get a lot in your parks for that. Do you know how expensive swings and slides and things are? It's mad. But I think that there is something really important about play space, particularly in our disadvantaged communities, because it's about building those habits for younger people, about just being in those spaces and being active. And I think that's so key. So I just want to really sort of, a bit more power to your elbow, really, when it comes to the planning system is the big one. And making sure that as a council, when we're having those discussions about planning, and we're talking about something called Section 106 money here, which is essentially what developers pay to the authority and other organisations to support their impact on a community, that we put in proper hard-nosed terms and conditions around when that money is given to the authority. Because we're in a situation in my own ward where we're still waiting on money for supporting play spaces that should have been given to us really when the development started. And the development started 16 years ago. So you know that this is a child's lifetime we're talking about here. So things like that I think are really important. And I think that has such a positive impact on preventative health measures that, anything we can do to strengthen that, and anything that our health partners and other partners can think about doing to support that initiative, I think could be really powerful.
Thank you, Councillor Webb. I completely agree about the spaces, about getting people out there, and it's about the spaces being accessible and people feeling safe and wanting to use them. So thank you very much, and thank you for those updates. Is there anything else anyone would like to add? Nope. Well, thank you very much, and I'm sorry for running a few minutes over, but thank you.